day in Victoria, but there are important reasons for hope, and there is real momentum in the vaccination program. In particular, we have just had the highest 3-day period in the entire rollout, even though we're at over 80% first doses. And so that's real momentum. Australians stepping forward, 1,018,000 vaccinations over a 3-day period, the highest 3-day period in the rollout. And what that says is that Australians are still coming forward in record numbers to be vaccinated. And if you haven't been vaccinated, or if you're due for your second dose, now is your time. Please do not wait. Please come forward. Please protect yourself. Please protect everybody else in the community, and please help bring us closer to those freedoms, which are such an inalienable part of our daily existence as Australians. Very significantly, we've had 330,000 vaccinations in the last 24 hours, which to last night took us to 29.97 million vaccinations. So at about 10 a.m. today, Australia will have passed the 30 million vaccination mark. Building on that, what we know is that that means we're now at 81.5% of first doses and 60.2% second doses. Australia has now passed the 80% mark for first doses and the 60% mark for second doses. What that means in the international context is, in terms of whole of population first dose coverage, we've not only passed the USA, but we've now passed Israel and the EU. And that's a measure of what Australians are doing by coming forwards. But there's more work to be done, and I would emphasise what I said earlier, to continue to urge people to come forward. One other critical thing there is that our pharmacies, I want to give them a shout out today. They've passed the 1 million vaccination mark, and to the Pharmacy Guild and the Pharmaceutical Society of Australia, respectively, they and all their members have played a great job in vaccinating Australians. At the moment, AstraZeneca, Moderna, they're being delivered in our pharmacies, and they're helping to drive these record numbers. So if you haven't been vaccinated, call your doctor, call your pharmacy, call a Commonwealth vaccination clinic, call the state clinic, and any of these will have opportunities. Now, when we look at what these vaccinations mean, we can see in New South Wales, as those numbers have dropped from being approximately 1,500 a day at the peak. They're now almost a third of the numbers in Victoria. But that vaccination program provides real reasons for hope in Victoria. And I know those numbers are confronting, but I also know that the vaccination numbers are going to make a huge difference. We can see that in New South Wales, and Paul can talk to that more generally. But as first doses and second doses rise, the protection rises. And that has led to not just the flattening of the curve, but the dropping of numbers in New South Wales, and that will have the same impact in Victoria. Another important part of what we're doing is the booster program, and I'm pleased to be able to announce the first stage of the booster program today. We've received advice from ATAGI, the Australian Technical Advisory Group on Immunisation, recommending that boosters or third shots be made available for the immunocompromised, and so we'll move to do that from Monday. This is for the severely immunocompromised, a group of up to 500,000. Paul, as Chief Medical Officer, will speak more to that, but it's about providing additional protection. The next stage, the general population stage of the booster program, we're expecting advice from ATAGI before the end of October, and we'll share that with the public. But we have over 150 million vaccines that are secured for the future, and so we're able to implement that on the time frame and with the urgency and immediacy that is suggested by ATAGI if and when they provide that, but we're expecting that before the end of October. In terms of other elements, the Chief Medical Officer has extended the hotspot in Victoria, and Paul will speak to that. And then another very important thing, whilst we're doing our vaccination work, is to continue the work of health protection around the country. One issue which I think will be immensely important to parents and to players is concussion in sport. Concussion affects many Australians on a temporary basis, and over 700,000 Australians have some form of brain damage. Concussion in sport can creep up. It's not just one incident, but having met with Michael Tuck and the family of Shane Tuck to talk with people about repair concussion and the impacts, is to understand how families' lives can be devastated and individuals doing something they love can nevertheless have long-term impacts. So I'm delighted that as part of our traumatic brain injury mission, a $50 million mission, we are sponsoring the Australian Institute of Sport to lead a nationwide focus on concussion in sport. This is about protecting our sports players, helping to prevent concussion, and helping to treat and recover from concussion. It's about giving people a long-term future so as they can play the sport they love whilst protecting the brain, which is so fundamental to every element of their being and their lives.